My name is Dr. Laura Steelman. I'm a pediatrician here at Bluebird Kids. One of the things I love most about working with kids and families is that you get to see them evolve over time. As a child gets older, they start to be able to blossom in front of you, be able to do more things that they couldn't do before. It's really a pleasure to tell yourself, I was part of that, as this child was able to achieve the highest potential, partially because we were making sure their health is what it should be and giving them any services they needed along the way. My journey to pediatrics began with my prior career. I was in developmental psychology, and so I worked with children already and had been for a long time. Some of the ways that we help the parents understand that we're here to help the child, not only with their physical health, but also with their mental health, is some of the questionnaires and things that we send to them ahead of time. Ask about those things, not only for the parent to answer, but also for the child to answer when they're old enough. And then address those things in the room. I don't wait for the child to say, I'm really having some struggles with peer pressure. We try to get them to tell us that before they even come to the office. And then when we're in the room, we ask about it and invite them to talk. Try to gauge how comfortable they feel with the different topics, but that's what we do. One of the things that I think is most important to focus on for children in pediatric care is the whole child. We don't only look at their growth, their vision, their hearing. We also want to make sure they have good mental health going on, make sure that they have good self-esteem, that they feel good about themselves. For some of the older children, especially recently coming through COVID, we want to make sure that if there's struggles with anxiety, with depression, with peer pressure, that we're on top of that. We're here to help with that. Being a parent definitely plays a role in being a good pediatrician. First of all, of course, if you're a parent, you have a lot of familiarity with all of the different stages and issues and questions that are going to come up because you've been through them already personally. It gives you some familiarity with what the parents are feeling, what they're thinking, what the children are feeling and thinking, and sometimes sort of the best way to approach it. A fun fact about me that my patients might not know is that I'm a beekeeper. We have, right now, I believe we have 8 hives. We started with just 2, and so we generally do honey collection in the late summer, so we'll be doing that before too long. We aim to give the very best pediatric care that there is to children, no matter what their resources are. A child who is on Medicaid or a child who has no insurance, that shouldn't be a reason that they don't get excellent medical care. I'm thrilled to help bring them to the Jacksonville area. I'm very proud to be one of the first doctors here at one of their first offices in the area.